Good afternoon and welcome to the Performance, Finance and Customer Focus Overview and Scrutiny Committee. Before we start these proceedings, may I bring to your attention to some housekeeping matters. There's no expected fire alarm testing today. Therefore, if the fire alarm does sound, please follow the signs to the nearest exit, follow the crowd. Essentially, you know the drill, members. Can I ask that you'll use your microphone when addressing the committee and that it's switched off when you're not using it, and that your mobile devices are turned to silent. As you will know, members, this meeting is broadcast live on the internet and will be capable of subsequent repeated viewing. By entering the Warspite room and during the course of this meeting, councillors and any others present are consenting to being filmed and the use of those recordings for webcasts. Thank you. Very good afternoon to you. Hannah, whilst you're not at your seat, I'm going to ask you if we have any apologies.
Sorry, Chair. We've received apologies from Councillor Hendy and Councillor McNamara, is here substituting. Councillor Tui's given apologies and Councillor Stevens is substituting, and Councillor Stoneman has also provided his apologies.
Thank you. Welcome to those substitutes attending. I notice Councillor Bingley's seat is empty. Do you have apologies? Are we expecting his attendance?
We are expecting him to attend. I've asked a colleague to give him a call.
Thank you so much. Okay, declarations of interest, agenda item number 2. Do members have any declarations of interest in respect to the items on the agenda today? I'm grateful. No declarations, therefore, to be recorded. Item number 3, minutes. This agenda item, minutes are set out at pages 1 to 22 of your papers. To confirm that the minutes of the meeting held on 15 November 23 and the Budget Scrutiny Select Committee review meeting held on 6 and 7 December 23. Eagle-Eye members who have reviewed these minutes will note that the minutes of the Budget Scrutiny process do not accurately reflect the final recommendation sent to Cabinet. The required corrections will be made in respect of these minutes. And just to note that the Council agreed as its last meeting to make the same recommendations to the Cabinet. So it's just an administrative issue with this set of minutes. So are there any other observations in respect of the minutes as you were flicking through those last night, members, over a cup of tea and a biscuit? Great, so I'll sign those minutes as an accurate set. Item number 4, Chair's urgent business. Members, due to the ongoing major incident in Keam and officers from the team being required to support, agenda item 9, serious violence duty, action plan and funding proposal, regrettably has to be deferred to the next meeting of the committee. I don't have any other further urgent business, therefore we'll move straight into agenda item number 5. Members, that's at pages 23 and 32 of your papers pertaining to the Finance Monitoring Report. Councillor Lowry, a very warm welcome, and I believe you're going to introduce the report today with the assistance of David Northey. Thank you.
Thank you, Chair. Thank you, members. So we're looking at the Revenue Monitoring and Capital Forecast Report to the end of the financial year 23-24. So this is period 9, so 9 months have passed and there's a further 3 months to go. I'm pleased to be able to tell you that the current net forecast overspend is £1.204 million. Just to give you some context, this time last year we were at approximately 2.8 million overspend, and as of period 8, when I last spoke to you, we were forecasting an overspend of some £4.254 million. So an improvement in period of approximately £3 million. We still have an outstanding issue in respect of the 1.2 that I've referred to, but I can assure you I'm working with members and officers to do our very best to get to a balanced position by the end of the financial year. The script that I normally say in these meetings hasn't changed. In respect of children's services, adult social care, SEND and community connections, which is principally homelessness, are all forecasting an overspend this financial year. Once again, just to give you some context, and this information is in the report, children's services at the end of month 9 was forecasting an overspend of some £8.9 million. School transport is forecasting an overspend of some £1.89 million. People's Directorate is forecasting an overspend of some £3.7 million. Principally, that's an extra £1.3 million for care packages and some £2.4 million relating to ongoing pressures for emergency accommodation for homelessness. This has partly been offset by budget savings identified corporately and thereby releasing some £4.8 million of contingency within the budget. In addition, we have used £6 million from additional income from business rate pool, which is normally held back as contingency and has been released this period for balancing our books. Additionally, you've also got a capital monitoring report included, which forecasts the budget as being £398 million, movements in period or forecast, and as set out in Table 1 of the report. You've heard me say before that borrowing costs are substantially higher than they previously were when a large percentage of the budget with respect to the capital programme was set out. So I'm currently undertaking a review with officers to ensure that our capital programme is affordable going forward. This report has been to Cabinet for subsequent approval and will go to full council on the 8th of March for further consideration. So unless you want me to go into any more detail, Chair, I'm happy to leave it there.
I'm grateful. Before members raise any queries, David, did you want to add to anything to Mark's update?
Very little. Mark's made it very clear this one will go forward as part of the budget papers to the March meeting for next year's budget debate, so that's covered off. I think we've been saying through the year, or I've been saying, that my level of comfort is if I get to month 9 and we're close to £1 million, it'll help me to sleep at night. We're at 1.2, so we're in the right ballpark. It's not where I want it to be, as I said at Cabinet the other week, but it is closer to where we have been, so we are getting there. And as we all understand, come the 31st of March, it will have to balance because that's our statutory duty. So 1.2, it's, as Mark has pointed out, a better position than we were this time last year. So that gives me some more assurance that we can do this. Thank you, Chair.
David. Members, over to you. Any questions for Councillor Lowry or David? Perhaps I can just... Councillor Stevens.
Okay. Thank you. Can I ask, in Annex 1, there's a list of capital projects for the next 5 years listed, a costed list. What risk is there to all those projects not being fulfilled, and what steps would be taken if things get tighter as it is nationally?
Very good question, but as you heard me say at my introduction, we're currently carrying out a review of the capital programme in its entirety, because if you were to add it up collectively over the next 5 years, we're talking about spending, from memory, somewhere in the region of about £730 million. Obviously, that's a lot of money. Many of these projects were given approval on the subsequent business case when interest rates were a lot lower, so therefore our borrowing costs are higher now. Additionally, we've seen the effects of both COVID, the war in Ukraine, and inflation having an impact on many projects. You know, just to give you some examples, projects that were previously priced at some £10 million are now forecast to outturn at £20 million because we're seeing some substantial increase in construction costs as well. So there's an obvious need for us to do a complete review of the capital programme and ensure that all the decisions that were previously made and the affordability of those projects are still relevant. So we'll go through each project line by line, and many of course come with government grants or funding from contractors, and some are already in contract, some need to be rescheduled based on circumstances. So there's a complete comprehensive review that needs to be undertaken, and obviously we'll do exactly that. But as we move forward, you know, I'm welcome to take in consideration the views of the scrutiny panel once we've done that exercise, and we'll come back to you and report to you as to exactly what's in and what's out. But I can't say any more than that at the moment until we've completed that review in its entirety.
So just Annex 1 is, as you pointed out, so suggest that there's 27 million of new projects coming forward. I just point out that the biggie in there is about 2/3 of the list down there. Purchasing Temporary Homes Programme, 15 million, which we discussed at length at the scrutiny, and I'm sure Councillor Penworthy can give you more detail on that, but that's an obvious example of we need to invest because, as Councillor Larry pointed out, the budget is overheating in terms of homelessness and bed and breakfast placement, so we have to break that cycle, and that's part of that programme.
Thank you for the clarification, but obviously these are a 5-year programme, so there's, you know, variances in terms of delivery where they are.
I would just add, Chair, whilst we're undertaking that review, I don't think people should get unduly nervous that there's suddenly going to be, you know, all these projects that referred to on page 32 are suddenly going to disappear. That's not the case. It's simply good governance at the moment. We know there's a pressure, so let's go through it line by line and make sure the decisions that were made some time ago are still entirely valid.
That's entirely eminently sensible. Yeah, we would expect nothing less. Councillor Gosling.
Thank you very much, Chair. Would either of you like to speak to the major change in this month's report compared to the last one, which is the release of £3.5 million of contingency? Can you speak to why this month and what's going on there? A bit more detail.
I'll take that one, Chair, if I may. Good question. I thought when you started that you were going to talk about children, and I was ready with
I'll come in with that in a moment.
I'm not the expert on
Keep that
children.
answer there.
So, I have to be prudent when I'm putting a budget together, so I have to try and keep some contingency back that I hope I never have to call on, and I can have conversations when we're doing the end of year reviews with Councillor Larry about what we do and how we carry that forward. But we've reached the point that we've got to get the numbers down, so I've had to have the difficult conversation about releasing some of those contingencies. So that's the reason why it's come out this month.
So that's why precisely this has to come out this month rather than the previous month or any other month. Why decision to release contingency now?
Well, this particular contingency was wrapped up in other conversations that we've been having with our colleagues at DLAC about the pension deal that we did back in 2019, and the stage that we've reached with those discussions gives me the belief that I can now release that contingency to help balance the books.
Thank you.
Councillor Poyser and then Stevens with a PH.
Thank you, Chair. It's just to follow up on the question around contingency. And well, first of all, I want to congratulate both of you on the work you've done so far with teams and the progress you're making. There's still a little bit of way to go, but I know the hard work's happening between the teams and the directorates. It was more around the contingency, the release of contingency now, but what other pressures that places upon services elsewhere, potential risks in this budget year, and anything in the next budget year as well, potentially, with those contingencies. I don't believe we'll have any in the following budget year.
So as David said, throughout the year he looks at forecast overspends that are happening on the council, and he's obviously forecast those in respect of this budget. In addition to that, we always hold a set of contingencies and we release those contingencies when we've got the necessary assurance that it's appropriate to do so. So if you're looking at treasury management, for instance, you know, you can't release the contingency at the beginning of the year, because if there is an issue in treasury management where you're gaining more money or less money as a consequence of the movements of the market, you can't release that contingency. Now we're in a position where we know there's some assurity around our investments and our borrowing, we can release that contingency and transfer it into the budget. And it only obviously has an impact in this financial year, because at the beginning of a new financial year, we'll reset the budget with a new set of assumptions around the effect of interest rates and borrowing costs and investment strategy. And therefore you'd set a new contingency alongside that. And as the year goes on, you release those contingencies to deal with any issues that may be occurring. It's no secret, it's in the report, these contingencies, you know, we have them every year, and we only release them when we get the assurance that it's appropriate to do so. And as David said, we've had the assurances around, for instance, the pension fund and our investment strategy, that we're in the right place to be able to make that decision.
Thank you, Councillor Lowry. And are there any other directorates or budgets that you may have that you've had to consult with in order to make those decisions to release contingencies as well?
But yes, I mean, it's a corporate issue, isn't it? The fact that we are overheating. But if you look back through the reports that we've been showing you through the year, we've been releasing different contingencies at different points as and when we had reason to do so. So there was 300 in there for street services, for instance, which we got to the point with the department where they said that was not required. So that came out, and that was something like month 5. So it's not something that's just coming out now. We are working and probing to get there. So as I said, I'm comfortable that we've got the right information to be able to do that now. And as Councillor Larry said, part of my budget process setting next year and the questions back is to make sure that we've got enough cover just in case anything does crop up, and it will crop up, won't it?
Councillor Stevens.
Thank you, Chair. Okay. Following on from that longer term, David, you mentioned about overheating and so on. Obviously, there are local authorities throughout England that are already burnt in terms of, gone kaput financially. Because each year there seems to be less money coming in from government, not seems to be, there is less money coming in to meet real need. And then the danger is then, as we're cutting and cutting, the services contract and pressures exist. How far are you looking at in terms of where would Plymouth be in that scheme in terms of getting close to some authorities that have actually had to have government intervention because of lack of finance?
Well, I can't speak for other local authorities. You yourself have probably seen some newsworthy comments in respect of many local authorities around the country and what's happening in respect to their budget. We have the monitoring report before you, which should give you some confidence that obviously by the end of this financial year, we'll hopefully be in a position where we can balance the books. And obviously, as David said, it's a statutory duty to do so. So we need to make sure that if we don't have the money, then we need to make provision for that by either releasing further contingency or reserves or actually cutting public services. You'll be also aware that we have a medium-term financial plan that sets out our 3-year plan going forward. And of course, we have presented to yourselves via budget scrutiny and to Cabinet and to Council in the coming weeks our budget for the next financial year. But as you've consistently heard me say, and many before me, the areas where we're receiving significant overspend, children's services, adults, SEND, homelessness, those are all front-facing demands from the general public that need our support. Many local authorities are struggling to do that. They're having to release reserves. Some of them don't have sufficient reserves to do so. Some of them have declared already a Section 114 notice. Some have technically gone bankrupt. You might have seen what's happening in respect of Birmingham recently. They're announcing a 10% council rise this year and a further 10% next year, along with a 25% cut in their budget for adult social care and children's. And you may have heard publicly, many local authorities have said if the situation continues as it is for a further 2 years, then all local authorities will be in financial trouble. That's just a matter of fact. You can just look at the paperwork and you can just project what's going forward in respect to those demands, that unless we get some help at some stage, then we'll all be in the same pot together, sadly.
I'm mindful that we're currently eating into Councillor Penberthy's time, and but if I may, finally, as there are no other speakers, again, it's very pleasing to see the direction of travel in terms of the gap being closed. Two questions for me: the release of the 3 million or so at period 9, and Councillor Gosling's explored that. Do we have other releases lined up? The gap is still 1.2. Are they factored into this gap, or are they sandbanked, ready to deploy to make sure that we achieve that deficit, to make sure that we come in to comply with that statutory duty of balancing the budget? So that's a very short question. And the second, if I may, and you can decide who answers which, children's services. it continues to worsen, but you've been managing that message throughout. You've told us it's continuing to worsen. I don't think we've seen the peak, but that's up to you to tell me. But you know, that figure has consistently got worse each time because of the pressures. Are we likely to see more, a further increase, therefore putting more pressure on that 1.2 figure? Is that going to go further north, that 1.2 figure? So those are the two questions. You can decide how you're going to answer those things.
Sorry, Chair. The first part of that question, I was so concentrated on the children because I knew that would come up. What was the first part? That was about the.
So,
are there any other contingencies?
yeah,
I beg your
yes.
pardon. So, so I think I've been consistent in my message wherever I speak that if we get to this magic million when we get to month 9, we've got what I call a ski slope into the end of March. So, if you look back on previous years, spend tends to either slow down or catch up with itself, and departments start to release little pockets of money that you're never sure whether you need it or not. So you might have a training budget and you've got to December now and you think, well, I can now hold on until the new year, so I can now give that back to the pot. So I'm quite confident that that million will float around, and I will assure anybody that is really interested, there will be lots of costs that go up and there'll be balanced by costs that equally come down, and at the end of it, it's got to come down to $1 million. So yes, I've got in my head how this balances, and I've got little where I might need to go if I have to, but I'm confident that the directorates themselves will drive through the £1 million savings. So that's that one. In terms of the children, again, I think the message has been very clear. It was going to get worse before it got better, and this is more evidence of it getting worse. So what Councillor Lowry's challenge to me and to the Children's Directorate was, this year's budget is what this year's budget is. Make sure that next year we are in the best position we can be, which is why we're giving £12 million growth, unprecedented, to the Children's Directorate, with only, I think it's 2 million of savings coming back, which they have offered up as very easy sort of savings to make. So we haven't given them 6 million and said, by the way, you've got to make 5 million of efficiencies. We've listened to them and we are supporting them. And there are all kinds of working parties and partners working with us to make sure that the Children Directorate is delivering the best for the children, obviously, but the best for the budget as well. So that is why that you've seen all that growth going into next year's budget. Yeah.
Councillor Larry, thank you. David, thank you for that also. I appreciate your attendance. I think, David, you're staying, aren't you? You're Ross for the moment.
I am. Fred.
Yeah, okay, excellent. Thank you so much. Item number 6, Corporate Plan Performance Report and Risk Update. That's you, Councillor Penberthy. Over to you to present your report. Thank you.
Thank you. I'm hoping Councillor Larry might stay in case there's risk, because that's him, not me. So the performance report before you gives you an overview of how we're performing against our priority indicators agreed as part of the corporate plan 23 to 26 in June of last year. The KPIs detailed in the report are for the third quarter of 23-24, that's October to December, and use the latest data available. Obviously, because of data sets, some of those data points are older than others. As I've mentioned previously, we're currently incrementally improving transparency and context of reporting. So you'll see in this report, we're using new tools available to us to present some of that. This is the first step in enabling us to add our more national comparators into our reporting through our work with the Local Government Association LG Inform programme. In addition, where it's been possible, a longer time series of data points has been used to prepare for greater utilisation of control charts, which will help us to establish whether performance is stable and operating within expected variation. This will prevent overreaction to normal performance variability whilst prompting quick responses to anomalies, and help you to spot where there are things that are out of the norm rather than just business as usual. As I previously promised, we're now using additional data sources. So, for example, Department for Education statistics, LG Inform, local and national and SIP for comparator groups to provide contextual reference points for evaluating our performance. So we're not just looking at how we're doing against ourselves, but how we're looking against others. The KPIs where we've already done that are listed on the front page. Areas of good performance this quarter include that the employment rate has risen by 2.3% since quarter one and is in line with our SIP for comparator group and the national average. The number of antisocial behaviour incidents reported to the council has decreased by 104 over the quarter. The number of young people aged 16 and 17 in education, employment and training has had its first significant increase from the 2021 baseline, with 3% more of 16 to 17-year-olds in EAT. Repeat child protection plans have reduced by 2% in the last quarter. That's where we're beginning to see some of the work in children's beginning to take effect. And 332 households were prevented from becoming homeless in the last reporting period, an increase of 115 on the previous quarter. We know that there are still some challenges around. The percentage of people accessing the Stop Smoking service who have quit reached its peak in quarter four of 22-23 and has since reduced by 6% at quarter two. This data is always a quarter behind. Key stage 4 pupils achieving 5+ in maths and English at the year end of 2021, Plymouth was slightly outperforming the South West and the national average. Since then, performance has dropped back below those comparators and shows a decline of around 10%. And dental waiting lists, despite what Mr. Mercer might have said recently about these all being under control, our local data suggests that in the last quarter, an additional 30 children and 315 adults have been added to the total number of people on the dental waiting list in quarter three. There are a small number of indicators that are listed as under review or in development. These are subject to ongoing due diligence prior to reporting or are still being developed to ensure that the most suitable and reliable data is reported. During quarter four, we're preparing for the review of our performance framework for next year and we'll be developing targets for that alongside additional reporting that we will be adding to this report to you in order that you have further transparency and context. Thank you, Chair.
Members, any questions for Councillor Penberthy on his report? Sorry, Councillor Moore. Thank you.
Thank you, Chair. Thank you, Chris, for the report and all the work that everybody's been doing to get this formalised. It says it's impressive to see that homeless prevention is improving, and I see that's in the report. Is there anything else we're doing to supplement that, which isn't in the report, that you could share with us, please?
Thank you. Yes, I think prevention is the first thing because we don't want people to be homeless in the first place, but we are looking at what more we can do on the temporary area. The £15 million that David referred to earlier, 10 million was from us and 5 million was money that we were seeking to secure from other sources. We put it in the capital programme in one hit rather than having to do lots of decisions. We are very optimistic, given the latest conversations, that we will achieve that full £5 million of additional extra funding to provide temporary accommodation for families, and that's really good news. And once that's coming out, I will celebrate with you, I'm sure, and be saying very big thank yous to the people who are enabling that. Similarly, today, we're putting our hands in our pockets again, and there is an executive decision that if all the boxes manage to be ticked on time, will be being published today for a further £1.5 million worth of capital expenditure as a loan to Path, to enable Path to buy up to 5 more houses to be used as temporary accommodation for single people, to actually take some of that burden. Those will actually help on the long term in terms of how we're able to put wraparound support for single homeless people, but will also reduce our dependency on pay-by-night requirements, which will help us on the budget problems we all have. So we are working on it as a holistic approach, and we are expecting some further announcements any day soon once embargoes have been lifted that will further help us on the temporary. Meanwhile, our team are working really hard, doing a lot more face-to-face work in New George Street and out and about to try and prevent homelessness. The big one is still Section 21 evictions, and working with landlords to stop Section 21 evictions can be really hard. But if we can do that, that is a real win. So there is lots of work happening. The longer stream is how we get more houses built, because ultimately we need more affordable housing to help relieve the pressures on the housing waiting list and provide more choice for people so that we can actually move people from temp into permanent. But that is a longer piece of work, and I look forward to introducing Plan for Homes 4 to Cabinet next month. And last week I was in Scrutiny, on one of the other panels, talking about our ambitions there. Thank you.
Thank you. Councillor Bly.
Thank you. I just wanted to comment really rather than ask a question. The performance report is really useful in the way that it's laid out, and I'm wondering whether that's helped in terms of monitoring for your purposes, because it's really useful the way that we can see the information now.
Yeah, I think it helps myself and all of my fellow cabinet members. We, as you can see, the beginning to put some of those longer term trends and graphs in is really helpful. We're using a lot more artificial intelligence and technology to enable us to do that. So this is actually a printout from now a system as opposed to being manually produced. That means it's quicker for staff. What we hope to be able to do soon is release you that snapshot both as a printed document and as something where you could slide along that scale and see exactly where things were, and so more interactivity if you wish. The control charts, when those go in, will be really useful. A number of people keep on saying to me, oh, in November we always get a peak in rough sleepers. Yes, we do, because in November we have one night where it's not just the usual team, it's supplemented by lots of other people. It's overseen by the Home Office and DLUC, and we do a really intense count across the whole city of every rough sleeper, every known rough sleeper who can't be found, people sleeping in cars. So every November we get a real peak, but we haven't got the resource to do that every night. I think if we did, we'd just see a different trend all the year round. But we're able to explain some of those things. So I think the way we're going is actually helping us manage our understanding of the pressures on the service, which then helps us work out when we need people in places, when we can timetable things to be done in slack periods, and when we can actually know we need people because we're going to get an influx of people hitting a particular service front door because that's the annual trend. So it actually helps us plan across the whole council how the fewer resources we have are able to be better used, and when we need to actually deploy some one-off resource through an extra bit of commissioned work or bringing in a temp to do very specific things, which helps us manage our budgets better. So I think performance is really important, not only as a report, but when we get it as a management tool. And what we're seeking to do through all the changes is to turn it into a better management tool for officers, a better tool for us as Cabinet to strategically lead, and then for you as scrutineers to be able to work out how best to ask us questions to improve service. So that's why we're doing it. If you've got any further suggestions, please do let us know. Ross and I would be really pleased to hear. Sadly, Ross isn't with us today, and David's being Ross as well, because Ross is across the hallway on a Keyham briefing, and we can't have him in two rooms at the same time, no matter how clever he is.
Well, I'm pleased to see you, David. And you're adding value to the meeting, and don't let them try and persuade you otherwise. Councillor Pemberley, just an observation, it is encouraging to see not only employment up, but young people, 16, 17, that's often a stubbornly high, frustrating figure. So it's good to see that continuing trend. But I echo what Councillor Bice said about the format of the reports. It makes it more meaningful in terms of observing this. In the absence of a very late Councillor Allen to the table, over to you, Councillor Allen.
Very quick one, thank you, Chair. The work you're doing with residents who know how to get involved in local decision, that's gone down. I think I commented on this at a previous meeting. I just wondered how that was going and if things are getting better.
That's a really difficult one to track because it's a figure that we produce through our surveys that go out to resident surveys. One year it's on our services and the next it's on broader issues. And as I think I previously said, there was some stuff going on at the point that survey was taken where people were feeling particularly disenfranchised. We're working hard through the way we're trying to engage as an administration to ensure that residents feel more involved in process. And I know that there are lots of areas across all of our areas of responsibility where we are doing that. We'll never totally satisfy everyone, but we're very proactively seeking to change the perception of one issue tarring absolutely every part of the council, because I think that is an anomaly that we will see next time we get figures beginning to reverse.
Yeah, you've advised on that each time you've appeared. I think we're conscious of that, so we'll hopefully see that disappear or fall off the graph. Indeed, I was going to move on because I'm mindful that of agenda timings. Councillor Poyser, you've been added to the list. If you could be brief on it, we'll move on to the next item then.
Thank you, Chair. We'll keep it brief. There's a couple of points on there. There's one positive aspect where there's an improvement in performance around reduction in annual carbon dioxide emissions. I think we've got in here, which looks promising, doesn't it? Seems like we're going back to the baseline in 2023. Is there any particular reason for that? I know appreciate you're not the cabinet member for that area, so yeah, just wondered whether that was a particular reason. Oh, I do have one supplementary after that, if that's possible.
In terms of baselines, we've tried to be fairly consistent as 2021. There will obviously be some areas that want to go back further. I would trust that when the performance of specific cabinet members is being looked at in their scrutiny panels, because this scrutiny panel is an overarching on the framework and this area, that those scrutiny panels would be picking up some of those longer term, because things like house building are very long term. Carbon is very long term. If we were to try and turn the performance report into a 10, 15-year baseline overall, it would be very difficult for us to maintain it. So that we've just tried to be a bit consistent in what we're doing here, and quite often it's the last data point, and the previous data point might have been too far behind to hit the 2021.
Just a follow-up question, if that's possible as well. Just in relation to residents who think people from different backgrounds do not get on well. Obviously, there's a reduction there on the previous performance. Previous one being 55, this is 42%. That's for me flagged up a concern around potential hate crime. And I just wonder whether that correlates to any increase in hate crime in the city, given global conflicts happening at the present moment, very dominant in the news.
My understanding from a conversation I've had recently with the police is that some hate crime is actually beginning to drop. When there was some work done recently by the Police and Crime Commissioner, 19.6% of hate crime in Devon, Cornwall and the Isles of Scilly happens not in Plymouth, it happens in St Peter and the Waterfront Ward. So I have a very keen interest on what happens with hate crime. I think there is once again an anomaly in this, because if we go back to the impacts of Brexit, where people became very, very polarised on opinion, that is still having some tail, and that begins to see. There's a lot of work going on work to support communities and how they work together. So our community builders are doing a lot of work out there. There's lots of work on community cohesion happening outside the council, but with partners that begin to change that. So I think that once again, that will be a bit about, there was a lot of stuff happening in global politics that was impacting on local feeling. I'm hoping that we can see through a lot of positive work that will change. And, I'm having a lot of conversations because there's no budget. to do any of this, it comes down to cabinet members. I'm spending a lot of time with Angela as our Welcoming City champion, out and about, talking to communities, working out from different communities' perspectives what we need to do. And we're trying to drill down into all of that at the moment with people from a wide range of voluntary and community sector organisations and different communities in the city to see what that actually looks and feels like and how we can change it. I hasten to say we're getting very positive comments from a lot of communities at the moment about how welcome they feel in the city. So the experience here might well be reflecting a part of the community and not the totality of the community. So, you know, it's something I'm really conscious of, because what I don't want is a breakdown in communities, or communities feeling they all have to live in separate enclaves to feel safe, because we are well known nationally for our work on cohesion and inclusion in the way that our population is spread and works, and we want that to continue. So it is something I'm really conscious with that part of my portfolio on. And in fact, Chair, sort of following on from that, I'm aware that in your next briefing you've got something on the public sector equalities duty. I will stay for that, as that's a statutory duty we're about to review, in case there's any specific questions on that.
Thank you, Councillor Penberthy. There's no further speakers. Thank you for presenting your report, and you're more than welcome to stay. We encourage people to join Scrutiny, so please do feel free to pull up a chair at the back or where you're most comfortable. Members, that brings us on to agenda item 7, policy brief. Do we have Kevin online? Yes, we do. Good afternoon, Kevin.
Good afternoon,
I believe you're going
Chair.
to present to the committee your report. Thank you, Kevin.
I'm not going to present a report, Chair. I'm just literally going to draw members' attention to the fact that we are currently consulting on our new set of equality objectives. So one of our public sector equality duties is that we're required to set one or more equality objectives every 4 years. We last set them in 2020. We're now required to set a new set for 2024 to 2028. Obviously, we want those to reflect the needs of our workforce and our communities. And to ensure that we do, we're gathering feedback on some draft objectives at the moment. So I just wanted to draw members' attention to that, really. If anyone would like to provide us feedback on the draft equality objectives, they can do so via the Plymouth consultation portal. The deadline for that is the 28th of February, which is why I thought I would draw your attention to it today. I have given the link to Hannah so that she can circulate it with the notes, but given the tight deadline, we might want to do that right after the meeting. I didn't propose to present the objectives to you today. They're available on the website, and I think members can look at them for themselves. From there forward, we would then take a report to Cabinet, embedding the results of that consultation in a set of proposed final objectives for Cabinet, and that paper will go on the 11th of March. And we then have a statutory deadline to publish them by the 28th. The objectives themselves will be supported by an action plan which is yet to be developed, and that too will go to Cabinet later in the year. And that I think would be where members of this committee would have most interest, because you would then, I think, be looking at scrutinising our performance against the action plan. These are 4-year objectives, so as Councillor Penberthy was pointing out a second ago, these rather more long-term objectives are difficult to pick up in such a thing as a corporate performance report. So that's the opportunity. There's an opportunity there to have a look at them now and to be part of that consultation up until the 28th. If you would like to have a more detailed conversation about them, you could speak with my colleague Sarah Gooding in the policy team, and she would be happy to hear from you. And that's all I wanted to say, Chair.
Kevin, thank you. We're always very grateful for your updates. Kevin, I think it would be helpful for members of this committee to have that link. So if Hannah will distribute that, I wonder if there are merits in that to be shared to all 57 councillors. If that's not happening, perhaps it should happen. Would be a recommendation that
I think,
everybody
Chair,
can
it's been
engage.
in one of the councillor weekly bulletins at the start of the consultation, but we will recirculate it to the committee.
Sometimes the message gets lost in those weekly bulletins. People skim them. I'm guilty of that. But I think given the gravitas or the importance of this, maybe a separate message might be appropriate in circumstances to all councillors.
Thanks, happy to do that.
Thanks. Members,
we
any,
can do that,
question for
Chair.
Kevin on that? Kevin, unless there's anything else, we'll allow you to enjoy the rest of your afternoon on the water there.
Chair, if I just
Thank you.
might pick up from Councillor Poyser's point earlier. Our first objective is about Plymouth being a welcoming city where we work together in partnership to promote equality, diversity, inclusion, facilitate community cohesion and support people from different backgrounds to get on well together. The fourth objective is that we'll support diverse communities so they feel confident to seek support and advice, report crime and antisocial behaviour, including hate crime and hate incidents, and work with partners to ensure Plymouth is a city where everyone feels safe and welcome. So we have built those into our next four-year strategic objectives. Subject to the consultation, of course, they're the ones that we started with.
I'm grateful. Thank you, Councillor Pemberley. In the absence of any further questions, thank you, Kevin. Thanks for joining us today.
Thank you, Chair.
Members, that brings us to agenda item 8. And that is HR and Organisational Development Priorities Update. Members will find papers within their bundles, pages 71 to 82. Welcome, Councillor Dan, and also Chris Squire to the meeting. Thank you. Good to see that you're still with us. Is it 3 months now? Gosh, doesn't time fly? And you're looking younger, healthier and happier. Yes, excellent. So, I didn't want to say, because people accuse me of being biased sometimes to my favourite councillors, but I'm looking forward to hearing how you've settled in and how you've enjoyed it and the good things that you've done. So over to you, Councillor Dunn, to present your report. Thank you.
So I'm just going to sort of set the report in context, really. You are probably aware that we had an interim service director before Chris joined us. And what we were very aware was that we didn't want to have a stop-start process as one service director leaves, then we had the interim, and then we've now got Chris as a permanent. So I'm going to talk about Chris just for 1 minute, just as they introducing my report. So we were very keen that we made sure that the continuation of the HROD service matched the priorities of the council. You know that we've been here many times talking about sickness, we've been talking about recruitment, we've been talking about retention, we've been talking about staff training, we've been talking about general resources, about apprenticeships, so there's been lots of things going on. So one of the things that the service decided to do was, before we set the trajectory for the moving forwards, was just to have a little bit of a recap which happened with the senior management team, just to make sure that what was being worked on under the interim director was still the priorities that we needed as we move forward. So I'm only going to sort of draw you to point 3.3 really, and here. So having spoken to the senior management team, they worked out what we felt was working really well within that sphere. And also they looked at what was happening within the HROD function as well, to make sure that we could capture where the strengths and the weaknesses were, where we need to put more priorities, and then come up for the priorities for the HR team, which then reflected back on the priorities for the council. So having said that, if you look at 3.3, which are the priorities for the team working forwards, as I've already said, recruitment and retention. One of the things we picked up was that we needed to improve our induction services, so that has happened, and now we do a bi-monthly welcome to make sure that all staff from top of the organisation down to the front-facing bit of the organisation have a proper induction. We know we're going to have to look at our HR payroll system. It's coming up for review, so we start to need to look at that now. There's a whole thing in there about staff well-being and how we support staff. So that is not just about what we do when they're in work, but you are aware that our sickness levels are going up. So it's looking at the whole well-being of staff. So we're putting in new programs for our managers so that our managers can manage their staff more effectively, making sure that we use occupational health, making sure we use the employer assistance program. So putting more of a wraparound service about how we do that. And then as you come down, if you remember rightly, we know we have to support the children's services because that is a cross-council priority. There are a number of restructures taking place, such as in street services and community connections, which are supporting the priorities of the council. And we've also had to look at how we can make sure that we become an employer of choice. So I've brought to the past here about how we're looking at adding 2 grades at the top of the organisation to build succession for our senior leadership team, but also improve the delivery apprentices and making sure that we can have mature apprentices within the council so we grow our own, and also to encourage young people to come here. We talked about not paying the apprenticeship pay, but making sure that they get paid the level of pay which is commensurate with the job that they're doing. So that's the sort of direction. You've got lots in there about where we are with some of the projects, but I'm going to leave it there. I don't know whether Chris wants to add anything and then just open it up for any questions that you might have.
I had to type something there. You might have noticed there's some unexploded ordnance in the city at the moment, and I'm in charge of bring the staffing piece together around that as well. So I've just been called into a meeting that I've declined. Thank you very much, Councillor Dan, for that. Yeah, it's been a good 3 months actually, interesting 3 months. And the priority here, one of the priorities, as has been said, is about the kind of continuity as well from the work, the foundations that the previous interim service director put in place, and making sure that those kind of feed into the work that Tracy, the corporate management team, and councillors would like me to focus on as well. So I will, we'll start with, we have a small HROD team. We know that it's not going to change. So it's about focusing in the right direction. But it's a talented team. It's a good team. We've got a good mixture of experience, really good experience, and very keen, bright, what for a better term, young things who we're bringing along at the moment. And when I say keen, if I look at the response to the incident, the bomb, and the way that they've stepped forward to join the Emergency Operations Centre, a whole group of them just straight in there, and others putting in their availability for when they'd be called up at the weekend and such like. It's a really good team. There are a number of priorities, but you can only have so many priorities that you can work on at any one time. So Tracy and I have just been working through my objectives for the coming year, and some of the kind of the basics that we really want to make sure are running properly, and those are outlined, or those are specified in 3.3. Staff wellbeing was mentioned. That is, I am cautiously optimistic that is coming down now with the interventions that are being put in place. So we make sure we have what we call a top 100 list that's published every month, is produced every month. The HR advisors work directly with managers and those staff affected to ensure that we're bringing people back into the workplace. So a lot of the rate at the moment is from episodes of sickness absence that happened nearly a year ago. So we're thinking that is starting to come down. So that focus on staff wellbeing there. The personal, I suppose, passion or interest of mine is around bringing younger people into the organisation through apprenticeships, apprenticeship frameworks, and we are developing a plan to do that as well. So we have somebody dedicated to that role. We're about to recruit an assistant into there, funded through apprenticeship incentive program. So we're not calling on additional revenue budget. We're kind of self-financing a lot of this stuff, making sure we've got those connections with schools, colleges, and such like. So leading to that kind of making sure that we're using the apprenticeship levy as best and as effectively as we can. We also use it then to develop staff in post as well, or who are looking to progress their careers in the council as well. So it's kind of a half and half split at the moment. So big focus on that. The only other thing to mention for questions, I think, is going back to the senior management grades as well. So that is part of the pay policy statement, the M&N grades, and making sure we have parity with other local authorities across the region and nationally as well when we're looking to recruit some of those heads of those specialist functions, heads of regeneration or whatever, where you see them advertised at a certain rate elsewhere in the country, and we come in at the top of our current grading system, a lot lower than that, and we have to top up with what we call market factor supplements, so temporary arrangements. You can't get a mortgage on those things. So it's how we start to rectify some of that. We have to be really careful with this stuff, obviously, because of staff morale, equal pay, and such like. So, but some good work there in the middle of that project, and certainly at the next meeting of this committee, we can update, hopefully positively, on that as well. But rather than me witter on, I'm really happy to take questions along with Councillor Dan.
Thank you, Chris. I'm grateful. I'm just going to look to the list to see who is first. I see Councillor Stevens with a V.
You did mention your favourite councillors earlier on, so I thought I'd get in early.
Your request is noted. We'll add it to the list.
Good job your microphone wasn't on there, Chair. The concentration and focus on staff wellbeing is extremely welcome, and it sounds like there's really positive action there to back up the words. Where do we see staff relations generally going forward? Because as we heard in previous items, it's a time as ever of financial worry and uncertainty going forward. So how do we see engagement with the staff and their elected representatives as challenges face the authority going forward, please?
We have a joint consultative forum which we meet once every 3 months.
Yes, we do.
3 months, yeah, every 3 months with the unions, where they put forward any issues that they have, and we have union representation throughout the council. And I've only had this portfolio for 6 months, so I can only talk about staff relations in the 6 months. But I have to say that when we go to discuss anything with unions, and not everything goes through that forum. So when we're looking at some of the restructures, and when we was looking at some of the grading things, the unions and the council have been proactively engaged. From my political opinion, I'll let Chris do from the officer opinion.
Thank you for the question. I think in terms of relationships with staff representatives, we've got pretty good employment relations machinery in place. So each service area has a joint consultation committee. I had one this morning for the kind of corporate centre, if you like, and David Northey was there as well. Giles couldn't because he's commandeering the incident at the moment. So we have that. We have some very open, frank exchanges, positive frank exchanges as well, which I welcome and would want. So where we have health and safety concerns, we have to have that being. People have to feel confident that they can raise those with us, and crucially that those will be acted on as well. So we have those for service areas. I meet with the lead representatives from our 3 recognised trade unions every fortnight, and we also have health and safety committees as well with trade union representation. In terms of staff engagement generally, there's work I really want to see happening here over the coming 2 years around culture and going out and talking to staff about the kind of organisation they want to work with. It's culture that really makes an organisation. If anyone listened to Saturday Live on Radio 4, you would have heard James Timpson talking about exactly what makes Timpsons tick. It was a fantastic listen. And it's that kind of, so we need people talking about culture, talking positively about culture, and crucially feeling that they're being listened to by senior leaders and politicians as well. So we want to start that work in kind of the medium term. In the short term, we have got the staff awards ceremony happening fairly shortly, so we've closed nominations there, so engaging with staff there. We have a network, and I think I've referred to this in the paper, of staff engagement champions. 19 at the moment. We look to build that network as well, but that was a direct outcome from the last staff survey, 2022. So we do another one of those as well. So yes, it remains a focus.
If I can just add, Councillor Stevens, I also know that there are voluntary champions like green champions, there are staff wellbeing champions, there are climate champions throughout the council as well. So there are quality networks. Yeah, there's quite a other sort of informal, formal groups of staff that work together on things that they're particularly interested across the council.
That's really helpful and positive. Thank you.
Councillor Gosling.
Thank you very much, Chair. As you previously noted, and it's been noted at this committee also, is the quite steep rise in sickness amongst staff. We're now significantly above benchmark. I was wondering if there's anything specific about this increase which is different from other councils. Is it in there any specific differences in the balance of short-term to long-term sick or the types of sickness? Is there anything you could talk to that?
I'll let Chris answer it because I have asked this question myself and looked at the breakdown between the short-term sickness reasons and the long-term sickness reasons. We're not out of kilter with other local authorities, but we have been doing specific work with some of the areas of sickness that have caused particular problems for the authority. So now I'll hand over to Chris. That's right.
So, yes, we do benchmark ourselves regionally, nationally as well, within local government and also with other sectors as well. There is we'll start on the macro side of it. There was a very detailed report last summer from the Chartered Institute of Personnel Development that used thousands of companies, organisations, private, public sector, third sector, that showed a national increase in sickness absence across the UK working population. And the reasons for those, predominantly in the short-term side of things, were mental well-being, actually stress, anxiety. And we then see that, so you take that as the national picture, that's replicated in local government across the country. And then if you look at the NHS as well, that has a higher sickness absence than Plymouth City Council, you'll see that replicated there as well. So the conditions that we see, and I see in other organisations as well, so we're not out of kilter, short term would be mental well-being, stress and anxiety, and then short and longer term musculoskeletal issues, problems as well. So where people are, well, it's not just pushing things and lifting things. Actually, I have a personal concern and some work to look at around the impact of hybrid working from home, and actually it becomes a little bit more difficult as an organisation to keep an eye on some of the kind of the factors leading to healthy working there. So I forgot the term for it, which I should know off the top of my head. Desktop something analysis.
Oh, your DSE.
DSE, thank you.
My pleasure.
Thank you, Councillor. That's really embarrassing. So we are keeping tabs on, but there is a line of inquiry I want to take professionally as well as the Plymouth City Council around the impact of hybrid working on increased sickness absence rate. I don't know if I know this happened at Plymouth and it happened at my previous organisation, Somerset. When we went into lockdown, sickness absence plummeted. Okay, and the reasons were that there were a mixture of reasons. People actually just wanting to pile in and help was one. That rallying call that really motivated people. But also there was this thing that for people who could work at home, if they were feeling a little bit not quite well, they would go, oh, I can still work, can't I? If you're faced with a half hour or an hour's commute or something, it's like, no, I can't face that. So that's why we saw sickness absence plummeting there. As we've come out of that, we're seeing the personal factors, cost of living, societal factors leading to increased stress and anxiety, I think, in the working population. So that's why we're seeing it across all sectors. I don't think Plymouth City Council is unique in what we're seeing. It is above the sector average, though. So that's why we've got this huge focus at the moment with named HR advisors working with managers, service areas, individuals, trade union reps. And I've started to see figures in some of our higher absence areas coming down now.
Yes, of course, sorry.
Just to build on your answer, we have seen a large change in a lot of the workers, especially on the council, in where they're working from. Are they working from home? And you touched on that, is on a part of that. Have you done any analysis on the differences in sickness rates and the different types of sickness rates you're seeing between people that predominantly work at home and those that work in more of an office environment? See if there is a differentiator. And also, can I ask about your DSE policy? Because it's usually the case that DSE is only taken in the main location of work. So if you work the majority of your time at home, usually the DSE analysis is done for your home environment. And if you're working in an office environment, the DSE would be there. So can I ask, do we are there any plans to do more of a DSE analysis in both locations? Because although you might be working 3 days in the office, 2 days in a rickety chair at home could be doing damage, causing your musculoskeletal sickness rates. Thank you very much.
So I haven't led an analysis on that last piece as yet, but one of the pieces of work I've been asked to do for the corporate management team is reported to hybrid working and the impact on the workforce, and that's both in terms of are we getting the right attendance, that kind of collaborative working piece as well. We're not saying everyone has to be in the office 3 days a week or whatever, but are we getting that right support in place for staff and colleagues and for teams as well, crucially. And part of that, though, has to be about the well-being of individuals and that bit about working at home. Now, on the DSE side of it, no, I haven't analysed the policy fully yet in my time here. I do know that we include an element of what your home setup is as part of that. Thank you for nodding, Ross. So we do include that, and that is analysed. But I can take that back to our health and safety team to provide a further answer if that's of interest, and either update at the next session or provide a written answer. That would help.
Thank you. Councillor Poyser.
Thank you, Chair. Just a follow-up to Councillor Goslin's question around sickness and absence as well. I just want to explore that a little bit more. I know you're doing lots of work preventative-wise to engage well-being, etc., to stop people from going absent sick, so changing the culture a little bit more, people enjoying being at work, as a pleasant place to be. But sometimes things do go wrong, people go off with stress, sickness, anxiety, they come back to work, whether we're exploring and gaining information and learning from that through back to work interviews or even exit interviews when people are leaving the organisation, understand the reasons why, and giving a really safe, open and honest space where people can have that conversation with us, because I think that's really important that we allow that disclosure. And that we can learn from it. I just wondered what we're doing in that particular area that's going to help us improve what we're doing.
Yeah, so we do run the return to work interviews, back to work interviews for people who have been absent, and we have policies in place to support things such as phased returns and such like, where just to facilitate people back into the workplace. So we do encourage that open dialogue. Exit interview processes, yes, those are we have those as well. I haven't checked, so I can't provide the personal assurance around the efficacy of our exit interview process as yet. So that's one on my list of things to have a look at. So it's recruitment and retention, isn't it? We need to understand exactly why people are leaving, what the reasons are, if they're concentrated in a particular area and such like. But that is on a list of things for me to be looking at. We do have that process in place, though. I do know that.
And just to add to that, Councillor Poyser, a part of the new, there's five new management modules which we're rolling out to managers across the organisation to start with children's services. And part of that is managing attendance and making sure that when you do those return to work interviews, they're meaningful.
I'm grateful, thank you. Councillor Ricketts.
Thank you. So Chris, thanks. Great report. Really comprehensive. On the sickness again, following on from Councillor Goslin, which departments have the highest level of sickness and which have the lowest levels? And are you seeing any trends with the management teams within that?
The highest rates of absence at the moment are within our people, within the people service area and also within street services as well. Within the people services area, we've had very high rates in the connecting communities team as well. That is coming down a number of high profile trying to think of a number of individuals with very high levels of absence there, but that is coming down. So when I referred to work that's been going on for a number of months now, a lot of those have been closed down. And I've seen the last report I saw showed that absence in that particular area had come down by between 20 and 25% over a period of a quarter. Within street services, we're seeing that because of the the big impact on sickness absence and street services is the musculoskeletal or the impact of musculoskeletal absence because of the nature of the work. Is what we're seeing there. Again, we have people in there, so we have working out of Prince Rock, we have a dedicated HR consultant in there right now, and I know health and safety have a kind of almost like a hands-on presence there as well. So we are working very closely with street services managers, but those are the two areas that we're focused on at the moment. We do have the other higher than average area is in our social care functions and children's services. You do see, I'm referring back to the NHS now as well, you do see high levels of absence typically where you've got regular contact with members of the public and especially vulnerable sections of communities as well. So that's one of the reasons why you see that, and also because of the stress and anxiety of working with children's social care. So,
as a supplementary, I know staff may give reasons for being off, but do you look beneath that as well? The cultural aspects, management teams, that although the mixture, sometimes you can pick up a trend. I've seen it in the past.
Yeah, you're absolutely right, and you want to be so the areas. If you've got a high sickness absence rate, obviously that's a line of inquiry, isn't it? If you then match that against turnover rate, appraisal completion rate, and other indicators as well, then you start getting a picture of what might be poor management practice or cultural issues going on as well. So yeah, so the reporting, the developments and reporting that have happened over the past 6 months for the workforce, I think is quite incredible. So it's, you know, I've given you an example of a flashcard. So that's so we have those for all service areas. Those are discussed with trade unions at service area JCCs, also management team meetings with HR attendants there, and also at the corporate management team. So with Tracy leading that, and each director has to lead the conversation on what's happening in his or her directorate as well. So we have all those indicators there, and I think, you know, sickness absence is one line of inquiry, absolutely. But you look at the cultural side of it, to look at the cultural side or management practice, you want to be looking at some of the other indicators, and we have that there as well.
If we could get a break, because it's a really interesting area, if we could get a breakdown for the next report in that sort of area, that would be great. Just so we get that little bit of detail of where the issues are coming from, because as councillors, there's nothing more frustrating, and everyone, when we're trying to get things done with street service, for instance, and people are off, it really does slow things down. So appreciate your efforts.
I welcome the request, and yes, we'll have that for the next committee meeting. Yeah.
Thank you, Councillor Blythe.
Thank you. A question for Councillor Dan. Given the budget constraints that we've heard about at the beginning of the meeting, do you have the resources to meet your priorities?
Very easy to say no, but I'm not going to do that. What we did last year, so when I, again, and I'm not making excuses, I only picked up the portfolio in May, there were legacy savings within the HROD area that have been put in by the previous administration. We've had to sign those off as one-offs this year because there was no way we could take more money out of the HROD function, which is already a very, very small, concise team. And if you think that HROD is one of those services that everybody in the council depends on it, it's a facilitating service, you know, it's the recruitment, the retention, the support of managers. So this year the budget has been rebased so that we can actually make sure that we know what the budget is moving forward. We've looked at what we do within organisational development, how that is supporting the rest of the council. We've looked at the priorities to make sure that we can build capacity across the council, because although you have an HR business partner, it's not necessarily the HR business person that does all the work. They're quite often advisory. So the more we can build capacity across the organisation with our supervisors, our team leaders and our managers, the better the HR function is. So the answer is, thank you, Councillor Blythe. I could always spend somewhat money, but in the year, this year and moving forwards, we have enough to work and prioritise on those priorities.
Thank you, Councillor Stevens.
Thank you, Chair. Just a quick one to follow up, Chris. When you said about the culture at work, following Councillor Ricketts' question, How does management respond to the staff who are present but who may be facing an additional workload because of staff who are absent for whatever? Because there's a danger that additional workforce for those who are present creates work-based stress or affects their health in different ways. That might be home-based, but it makes it worse if they've got additional workload stress. So how are management managing that situation to reassure them that there's only so much they can possibly do, given that there's absence?
I think the answer depends on the service area, to be honest. So we'll see, so for example, refer to street services again, and we see high use of agency there precisely to cover where people are absent. You'll see the same in children's social care with where you'd have longer periods of absence covered by locum social workers, for example. I always feel sorry for, and I would do for some of the corporate services staff where perhaps we don't have that luxury. And it's down to the manager then, isn't it, and the team to prioritise the work as best they can. And you know, I have one or two people who are absent from my team at the moment, and I'll talk with my direct reports about how we then prioritise that workload, redistribute, pause, postpone, however it's going to be done. But that has to be the art of management and leadership as well, doesn't it? But so where we've got operational service delivery, services running, you would short and longer term cover with agency. You know, you've got shifts to fill, absolutely have to do that. Where you might be kind of a longer term, where you're looking at longer term projects, some of the kind of corporate services work, then yes, there could be an agency member of staff, or you'd look to redistribute the work, pause, postpone.
Thank you. Thank you very much for your attendance. The report is certainly noted, and enjoy the rest of your afternoon. Thank you. Members, as I set out at the beginning of our meeting, agenda item 9 must be deferred due to the ongoing issues in Keyham, which is stretching the local authority in terms of attendance. So sadly, that must be deferred to a later meeting. That brings us on to agenda item 10, which is a return of the petition in respect of Plymouth District car parks. I note Councillor Coker is in the room, and Mike Arthurton is also present, and Councillor Nicholson, who brought the petition to this committee in the first instance. The purpose of the report to come back was to provide members with an update. You may recall, members, last time we were here, it wasn't quite clear as to the impact, the true impact of the imposition of the control measures that were placed in the car park. And what that looked like in terms of revenues, vehicular movements, and impositions of penalty notices for users of the car park. So we have been provided with an update report. I'm not sure who's presenting this report, so I put, that's not you. Come and sit up. Come and sit up. Yeah. Well, thank you so much. Rather than sitting at the door saying it's not me, Gov. So perhaps, Mike, if we could, turn to you in the first instance. We had quite a discussion at the last time. You will recall queries about those things I just mentioned. I'm grateful for the update in respect of your report, but perhaps you could talk us through that, and we'll hear from Councillor Coker and Councillor Nixon if they wish to add anything further. Thank you.
Okay, thank you, Chair. Good afternoon, members. In terms of, as Chair said, this report is intended to provide an update some months down the line now, following the implementation of the new measures within the Plympton car park, measures which were consistently applied to other district locations in the city. What the report simply sets out, I think, for me, just to reference on the starting at section 2.3 really is to summarise the changes and the initial impacts, and they were centred around the provision of support to local businesses, and that is talking about businesses who rely and thrive on the high turnover churn of customers and visitors. The fact that the parking was, the commitment was for the parking to remain free. Thirdly, that the actual parking restrictions that were in place previous were extended, so people were provided with an additional hour of parking time. And secondly, persons with blue badges were granted a further hour on top of that as a reasonable adjustment to any disabilities. And the report looks at within the report, we look at how we have new data and insights that we didn't have before, which comes from the people who visit the car park and register their parking sessions. And now with the weeks and months of data we have here, we're able to present a picture of what that data looks like. And what the report is really setting out in here is that there has been no decline in the number of people visiting the district. And what it's showing here is that from working in week numbers from week 18 through to week 2, which was January, it summarises the number of visitors in the car park, so over 400,000 people visiting the car park. And what I've also attempted to do in this report to provide an update is, from the very clear steer of the first session, was to include information regarding the number of penalty charge notices. And what I'm setting out in here and providing some context is that in order for the system to work in the way it was intended, which is to ensure fair use of the car park, is that inevitably the way that is done through the issuing of fines where that isn't the case. And rather than just create a headline of sort of saying, here is the number of tickets issued in this car park, what I've done to try and be helpful in here is to put that into context in relation to the number of people who have used the car parks at Plimpton, and then also do that in the context of the number of fines that the council has issued as a whole, and a further comparison to give you an indication of the level of fines that would be issued. And I've used one of the city centre car parks, and here is a comparison. So hopefully that's helpful and to provide an update.
It is incredibly helpful, and I think I gave you a bit of a hard time when we were here last time, and I'm incredibly grateful for that information, because with the imposition of the controls that were put in place, like most things, the rollout of this didn't go incredibly well, it's very helpful to have this. Councillor Coker, do you wish to add anything at this stage?
Thank you, Chair. As I will say what I said last time, as this was not a Labour administration's policy, we have inherited this. My role as Cabinet Member today is to listen to members' feedback, to listen to Councillor Nicholson's feedback, and the questions that you raised last time, which I'm really pleased that I have seen them, that the officer has given you everything we have as a city, is making sure that control measures are in place to give people an adequate time to visit limited areas of parking. And where we've done this on street with the free tickets on a machine on a street and limited it to 2 hours, the businesses, and I've got one in my ward, have been really grateful, and so have the residents. So I think it's, I would be very interested in the comments and the recommendations that come back to me. And, you know, that I will look at what you all say. So I think that's all I've got to say on that at the moment.
Your position is well reserved. Thank you, Councillor. Councillor Nicholson, welcome.
Thank you very much indeed, Chair. Good afternoon, and good afternoon, members. Thank you for giving me an opportunity to say a few words and to echo really Councillor Coker's point that this is obviously not his responsibility, but he's picked this up following a change of administration, and to also thank Mr Arthurton for a very detailed report. You may, for those members who were present last time, you may remember that the points that were being made by Councillor Beer and myself were around really the impacts, not only the need for churn, but the impacts on both Harewood House, which is a council facility nearby, which, if you're not familiar with Plympton, is effectively like a very large community centre function provided for the local community, but also places like the Doctor's Surgery at Mudgeway and the Plympton Clinic. And I would like to just focus my attention more on the basis of Mr Arthurton's report on the Ridgeway car park, which is the car park closest to Harewood House and to the co-op and to the Plympton Clinic, because there is a certain amount of differentiation between Mudgeway North and South, which is, for those, again, who are familiar with Plympton, is the car parks closest to the Iceland and St Stephen's Place areas of Ridgeway, and what's deemed Ridgeway car parks, which are closest to the co-op and Sir Joshua Reynolds pub and that area of the Ridgeway, which is at one end. Certainly, you know, there is evidence, and Mr Arthurton won't be aware of this because he's only in charge of car parking provision for the City Council, but if you're in corporate property and responsible for Harewood House, and indeed parks in relation to Harewood Park, which has the Plympton Tennis Club, Plympton Bowling Club and Plympton Tennis Club, all relying on limited car parking around Harewood House. Certainly those who attend Harewood House will know early in the morning that much of the car park can be already accommodated and filled by those who have effectively displaced by the new regime, parking regime in Plympton, in the Plympton car parks. And it's that which I'd like potentially Scrutiny to potentially recommend to Councillor Coker, that further work is done perhaps with corporate property and the NHS and Live Well Southwest who run the Plympton Clinic. The district nursing team operate out of the Plympton Clinic. And I don't know if you're familiar with the operation of the district nursing service. They're required to go back to their base on quite a regular basis to pick up supplies and obviously also deal with other health professionals, as well as service the local community. So their transport, their cars, their means of transport is critical to the efficiency of the service. And that at the moment isn't factored into the report because clearly Mr Arthurton's only dealt with it from a highway car parking perspective. So I would urge the committee to recommend to Councillor Coker in the coming months to look at some further work, both with our partners in the NHS, but also with our partners within corporate property, to look at the impacts on those two facilities. And it may be, for instance, that the clinic is given some dispensation maybe through the parking department to be able to park not just in their own private car park, which is occupied by the public because they don't wish to use the machines, that they can perhaps park more widely in the council's car parks and get some dispensation. But we need to try and emphasise the importance of Harewood House, the Harewood Park facilities, and the need to ensure that the public can continue to use those, particularly in the summer months when a lot of the outdoor activity takes place. And the car park isn't rammed with those who are avoiding the car parking machines in the Ridgeway car park. So that would be my appeal to the committee this afternoon, Chair, through you to Councillor Coker, and thank you very much for giving me the opportunity to speak to you.
Thank you, Councillor Nicholson. Members, I invite your questions or observations. I appreciate we have debated this previously, but I think you all understand the importance of us bringing it back. So first on my list is Councillor Poyser.
Thank you, Chair. Just following on from Councillor Nicholson's points there. Firstly, thank you for the report, Mr Atherton. Maybe just looking at a bit more detail, what we're actually looking at here, because this is really showing the patronage of this particular site from when the charge, the controls were first put in place up until now. So this is looking at, and it's a very, those two car parks are very busy. Look at it. But what it doesn't show is that displacement, which is occurred in terms of people parking elsewhere as a result of this. So actually, was there more patronage prior to that? Because we're seeing quite literally cars parking in other areas, such as Harewood House or Mudgeway Clinic, behind the Reece Centre, and that's putting pressures on those parking areas. And as Councillor Nicholson points out around district nursing and the use of those car parks as well to access those facilities when they need to come back to base, that is a particular problem. So I think there's two bits here to this, and I think maybe there's a recommendation here around if we're introducing controls that we're paying more attention to the surrounding community and the impact of the introduction of these controls. I think that came up at the previous scrutiny. And the other bit here as well is, what other ongoing reviews are we doing in this particular circumstance in terms of looking at the impact of displacement onto other areas, and can we do that elsewhere when we're reviewing controls and continuously reviewing controls? So I think that's my 2 bits from that, really. That's clear.
I'm going to bring in Mike in a moment, because I think what Councillor Nicholson has suggested as a recommendation, I know that you're already looking at. So I think that might be good news to hear. But yeah, consultation prior to such a scheme is imposed, and the impacts of that wider, again, that's something that as a local authority we would naturally be looking at, I assume, but I'll tee it up that way. And of course, members in our communities, and we're 3 Plympton councillors, they're pretty good, as all residents are communicating to us when there are issues related to highways and parking. So that's another form of keeping us in check. But Mike, would it be helpful if you could, as Councillor Nicholson was suggesting, could be a recommendation, which is what Councillor Poyser is also indicating, in terms of how you can look at that ongoing with the NHS and other users to ensure that there is no displacement. I appreciate there's always going to be an element of displacement, but how we best monitor that going forward here.
Thanks, Chair. Yes, absolutely can look at that. Just to say on that, really, that understandably, whenever we introduce any form of parking controls, be it here or anywhere, we're mindful that inevitably sometimes there can be displacement. So we are, and have been since these measures were introduced, keeping an eye on these areas. With Plympton particularly, wasn't initially identified as an area that it was seen as much of a problem, on the logic that Plympton has a lot of unrestricted long stay and parking on the roads that some of the other districts in the city don't have. But absolutely will look at that, Chair.
That's great. Thank you. On my list is Councillor Stevens, PH.
Yeah, just thank you, Chair. A couple of observations. It's very hard to monitor where people go once they park their car, and I don't know whether you can actually, what's the point of knowing that, I suppose. But the other issue is, if you did something in Plympton, you'd have to apply the same principles across the city, rather than have one locality issue. So I would be interested to see I don't know what data there is for car park patronage prior to this period. Is there data available for that time? No, okay. And could the same exercise be carried on in certain other? Because I think it's powerful for the residents to know. I would, as a councillor near the Plymouth Broadway, to know that the actual patronage of the car park is quite high, because this does seem to be improving. There is good patronage here. You'd be concerned if the numbers slumped all of a sudden, because that would have an impact on commercial activity, where people are not attending sports venues, community events, and so on. So it's just interested to see how this could be. I'll put a little cheeky request in here. Could you do the same for the Plymouth Broadway, please, when you're at it, just to see what patronage has been like? And also the fact that people are kicked off to start with about the hassle of doing it and so on, but they seem to have got through it. And when people moan that they've got a ticket on their car, rules are rules.
Thank you. Observations rather than questions, apart from the request to do this in Plymstock, is what you were saying. All right.
But also an observation that it's very tricky to track where people are going unless you tag them as soon as they park.
Yeah. Thank you. I have Councillor Ricketts.
Yeah, thank you. It'd just be really helpful to shape our minds on this, because we've got this report from Mike. What Patrick's proposal is. We need to digest that, and then that's going to shape how the discussion, isn't it? So if Patrick can explain what his proposal is, and then there'll be a recommendation, I'm sure.
Do you want just to repeat it?
Yes, thank you.
Yeah, so effectively what I would recommend to you to recommend to Councillor Coker is that Councillor Coker takes away this debate and the concerns about the impact on Harewood House council facility, and that's to Councillor Stevens, who's actually a caretaker who sits looking out of the window, who could actually take down some evidence. If you walk away from your car and you don't walk into Howard House or the park, you're clearly not using those facilities. So it'd be quite easy to capture some data. But for Councillor Coker to be aware of the concerns on Howard House, Howard Park, and the impact on the Plimpton Clinic, and do some further work in terms of collating that information and seeing what can be done to mitigate those impacts as a result of the imposition of these machines that unfortunately he's inherited. So that would be the recommendation. Is that clear enough, Councillor Ricketts, in terms of the recommendation that you recommend to Councillor Coker that he review the impacts of the recently introduced parking regime in Ridgeway car parks to mitigate impacts on Howard House, Howard Park and the Plimpton Clinic?
Yeah, fair enough. I just thought, we've got this kind of appointed situation we've had with the petition and everything. I just wanted a clear, we're in a scrutiny panel, a clear direction. I mean, that sort of thing I'd hope Mark would do anyway, to monitor all car parks. So obviously this is brought into a specific focus, but I'd hope Mark would do that anyway.
I'm pretty sure the recommendation is clear, and I've already had an indication that with Councillor Coker and Mike that will be accepted as a recommendation in terms of understanding if there is mitigation or if there has been an impact on Harewood House as a result of any displacement. So I think that's pretty clear. Councillor Stevens, you're not next on my list. Councillor McNamara, thank you.
Thank you, Chair. Quick question for Councillor Nicholson. You said that people are parking in the wrong places because they don't want to use the machines. Is that because they're very, very lazy, or are they doing illegal long-term parking, would you say?
Obviously, I use the car box a lot. It would be difficult, Councillor McNamara, for me to generalise on these things, but clearly the imposition of the new regime, and I suppose and don't take this the wrong way, Chair, through you to Councillor Arthurton, to Mr. Arthurton, but I think the policing of the old regime probably wasn't as stringent as the policing of the new regime. So there probably were examples where people should have only stayed for 2 hours, they may have stayed for longer. So what's happened is it means that because of the imposition of penalty charge notices, people are making sure that they park somewhere they're not going to get fined. So that's why the easiest point is to park around the back in Harewood Park rather than perhaps go elsewhere because the long stay is full up, or they generally, some particularly older people don't find using the machines easy. So I don't know, Councillor McNamara, if you've used one in Plimpton, but you have to stoop down, and it is actually quite difficult for some people with medical conditions to be stooping down and having to press the button twice. And Mr. Arthurton is being very fair that if somebody is unfortunately not using it properly for the first time, they won't be fined for the first time. But if obviously second time and beyond, they'll get a penalty charge notice. Hope that helps.
I'm grateful. Councillor Stevens.
Yeah, I'm cautious. I would caution the committee against going into too much detail here, and I take nothing away from Patrick's constituents. Like Steve, well, I was going to ask pretty much the same question in terms of what are we specifically being asked to agree to today. That's a very fair question. Probably to our colleagues on my left, as I look at the end table, is there anything unreasonable from your perspective, either sort of, I suppose, budget-wise or politics-wise, from Mike and Mark respectively, in terms of the request? I would guess, as I think Steve or somebody else said, that reviewing it in that sense, just seeing what the effects are, would be standard practice. I think, I don't know how serious Patrick was being. If we start to rely on caretakers looking out of windows as to where car parkers wander off to, I'm not sure that's going to be the most scientific method of working out the effects. But if that's all we're being asked to do, is to say that something's happened, what are the effects in a neighbouring car park, that doesn't seem to be unreasonable, but I would want to hear from excuse me, Mike and Mark on that before I rush to any judgment.
Please.
Thank you, Councillor Stevens. We do review all car park performances. That is part of the management of the service that Mike does. So it's nothing new to review how a car park operates and its efficiency and its ease of use, I would say. Councillor Nicholson has brought into the equation today 3 kind of bodies that are, in my opinion, worth looking at. Would I say that I would direct civil enforcement officers to spend the whole week looking at different roads in Plympton to see if people are parking there? Then the answer is a categoric no. It wouldn't be Devonport either. But, you know, as for value for money or cost, to do that specific work on top of the work we do already is not a problem. But to actually go excessively, as I've stated, to look at every option, every road, every space around the vicinity would actually be a waste of taxpayers' money. So I think that answers that question, Chair.
My list is complete. I'm very grateful for the information that's been provided through your report, Mike. I was quite critical at our last meeting because that information would have been incredibly helpful. I'm grateful for the monitoring. So I've got 2 hats today. I'm a ward councillor in Plympton, which this is affected by this issue, as all Plympton councillors are. But I'm also chair of this committee, and it's right and proper that we have proper scrutiny. So I have to put that to the back of my mind, my ward role. And I'm somewhat comforted by the data that you've provided, because anecdotally, and I said this last time, we attend various committees. We meet with our residents either through formal meetings or various correspondence, and anecdotally, the pictures that were being presented through those correspondences and exchanges was one of concern, and that's why it's here, because we were told businesses are suffering, revenues are down, vehicular movements are down, there's chaos at the machines, people are getting penalties. So it's good to have this data. The difficulty is, of course, is we had nothing prior to the imposition of these machines, so there's no comparative data. But this has been incredibly helpful, and it's incredibly comforting, certainly to the businesses in Plympton. And I do, like Councillor Nixon, like Councillor Poyser, and we all do in our respective wards, this is what my other hat on, visit these. I was only in the library the other day for a ward meeting with residents, etc., have your say. So we do constantly monitor, as Councillor Nicholson says, every time we're up in the Ridgeway car parks, he would note and various festivities going on in Plympton where we have fairs and what have you. So when the pinch points are hitting, particularly bank holiday weekends. So, but that's only anecdotal. So it's useful to be able to compare this with the anecdotal information that we continue to get. We probably won't be able to really have a proper understanding until maybe 12 months' time, where we can sit here and go, okay. But Councillor Nicholson's point about what's the impact in terms of that displacement that we have, notwithstanding the point you made earlier about Plympton being benefiting of a lot of free long-term parking across the 3 wards in Plympton, in the town of Plympton. But I think it'll be very useful to look at this again, maybe in 12 months' time, we'll be able to have a proper understanding. But I would welcome, depending on what this committee determine, I'm one member of this committee, as to whether any recommendation should be made and whether you are, it's a case of it's a matter of this is ongoing business as usual to monitor the imposition. So I think that's where we are, members. There's been a recommendation which I'm sure Ross has captured, and he's going to read that now. and we'll take a view and a vote on that, or is it a case of it's business as usual for the officers? Thank you.
Well, Chair, it was Hannah beside me that captured this recommendation. So I think we've got to note the report on the front sheet with the additional recommendation that a review is carried out into the impact of new parking machines on local facilities, brackets Harewood House, Harewood Park, Plimpton Clinics, and what could be done to mitigate the impact. And we will seek to provide a briefing to members on the outcome of that review, because you're not going to have another meeting to look at it.
So, in due course. So the first part of that recommendation is pretty easy. The report is noted, so I'm sure that's not controversial. I think body language says that can be agreed. The second part of that, as Ross read out, members, are you happy to vote for that recommendation as to go forward? We're going to do this, what, by show of hands? Is that the... Yes?
Can I just
come in?
Sorry, can I just check that Mark and Mike are comfortable with that? This isn't a subject I know a great deal about, so I've not been following it as closely, with all due respect, as our Plimpton colleagues.
Would you like an invite to Plimpton, Councillor Stevens? I'm more than happy to extend one.
Well, it's a long time since I lived in Cherry Park, that it would always nice to go there. But in seriously, I don't want us, certainly on a localised ward issue, which we don't normally get, to put unnecessary burdens on a particular arm of the council. If Mike and Mark can assure me that's not going to be the case, and this is pretty much standard, I'm more than happy to vote for it. But that's the rider that my vote is riding on at the moment.
Thank you, Ian. Under normal circumstances, I would say this petition has come here twice now. Councillor Nicholson has talked about the possible imposition to the park, to Harewood House and to the doctor's surgery. I can give a commitment here and now that the team will work with the Plimpton councillors and look at those issues, rather than making this a drawn-out process, because I don't feel, personally, I've always tried to operate my department to be able, or my portfolio, to be able to talk to councillors and do the right thing. So I would say, please don't make a recommendation. Let me work with Councillor Nicholson, Councillor Beer, Councillor Darcy, or Councillor Poyser, on the specific issues. And then, if you wish to bring it back next year, after the 12 months, I'm happy for you to do that. Let's not make a mountain of work. That was all I'm saying.
I'm very...
For the minutes, if the committee goes down that road, can it not be minuted that Councillor Coker has given that undertaking? Because at the moment, it's just been noted and nothing. I think for the public record, it wouldn't have come here had we had a cabinet member who's prepared to listen. We wouldn't have done a 3,000 name petition in the first place.
You're absolutely right. It wouldn't have come here had I not brought it back. You will recall, initially it was on the meeting and you and Councillor Beer couldn't attend. So rather than just noting it, I deferred it then to give you the opportunity, and then I invited it to come back because there wasn't enough information. So I think I take on board the point. This is quite the second or third time this has been on our agenda, but it is an important one, and the minutes will reflect that, as will the recordings reflect that. So I think what we'll do is note the report. I'm grateful for the undertaking from Councillor Coker that you will work with the Plymouth councillors, all 7, and ensure that we are managing the impact of that. Thank you very much for your time, all 3, and thanks again, Mike, for the figures. Members, moving on in the agenda now to item number 11, work programme. Do I need to say anything, Ross?
Well, given we've got no more meetings scheduled for the year, Chair, I think it's sensible that certainly any discussion on this is truncated. I think with expectation in the new year, certainly in the new municipal year, we would expect to have a move around of committee seats as we usually do, and it's at that point we'll take an assessment of what we need to look to over the 24-25 municipal.
Thank you. And
Chair, I just wanted to say on that last item, it was a sensible conclusion. I just wanted to, thanks for your interjections, because when I look around the room and I see parking issues in the wards, that consistent, it was great representation from the Plimpton councillors, but for that to keep coming back to talk about how free the free parking is when you've got a tight inner city parking issue was gonna get ourselves in some trouble there.
Rather than going backwards in the agenda, I note your observations, but I think it's important. We have a job to do here in Scrutiny, and we have to demonstrate democracy, and that's why I wanted to bring it back, because the members didn't get the opportunity to present it.
Overall messages, I'm saying well done. I'm saying thank you. We got to a good conclusion.
I'm grateful. Thank you. Tracking decisions. Item.
Well, yeah, both completed, Chair. So we'll pick up any questions, but I think it's as it's laid out.
I am very grateful.
Scheduled business meeting.
Members, that brings us to the end of the agenda. Sadly, this will be my last meeting as chair of this year. I hope you've thoroughly enjoyed it. I've enjoyed the experience, and I've learned a tremendous amount, and I'm incredibly grateful for your engagement throughout the year.
We thank you for your stewardship for the last municipal year, Chair.
Thank you. And that completes our business today. Thank you very much for your attendance, and those who've attended online. Thank you very much, Hannah and Ross, for your support throughout the year. And I bid you all good luck.